Steven, and today we're going to look at assisted stand to pivot, sit to stand pivot transfers while maintaining precautions from a bed to a chair. Today we're specifically going to look at three precautions. We're going to look at a patient with total hip replacement, a patient with sternal precautions, and a patient with hemiplegia on one half of their body. So with all your patients, you're going to want to start them sitting on the edge of the bed with their feet flat on the floor, so you might have to adjust the bed accordingly. And you're going to want to make sure you start with the gait belt on and make sure the patient is alert and aware. The first patient we're going to look at is a patient with a total hip replacement. And with this patient, we're going to be using a walker to assist during the transfer. And you're going to want to tell the patient to make sure they keep their affected limb underneath them at all times, no rotational movement or flexion or extension, with their kneecap facing forward as much as possible. And of course, you're going to want them to limit any pressure that they're going to be putting on that leg. So to start with, when I lift you up, I want you to put your hands on here, and we're both going to help lift you up off the seat, and then we're going to slowly rotate and sit you back down on the chair, okay? And as you step, I want you to step with the walker first, and then with your leg. With this patient, if possible, you want to try to go toward their strong limb, but of course that's not always going to be the case, and you might just have to make sure you maintain their balance and support in a different way if that's not the case. Okay. So, hands there. On the count of three, we're going to lift. So, 1, 2, 3. Okay. I'm going to slowly rotate. Walker, leg, walker, leg. Good. One more. I'm going to sit. Good. The second patient we're going to look at is the patient with sternal precautions. And this patient basically has some kind of injury where they're not going to be able to use their upper body at all. So you're going to want them to refrain from pushing off of the bed or stabilizing themselves as they begin to sit into the chair. So with this patient, we're basically going to have them hug a pillow. They're going to hug it across their chest. And then we're just going to basically assist them in standing and moving to the chair for stability purposes. Okay? So I just want you to keep holding that. Don't use any of your arms. And we're going to help you stand up, and we're just going to slowly pivot around and sit you in the chair. Okay? On the count of three, we're going to stand. 1, 2, 3. Okay. Just take short steps. Good. And then we'll sit back down. Good. That's it. The last patient we're going to look at is a patient with hemiplegia, and they're not going to be able to use either limb on their affected side. So we're going to be stabilizing them more on the side this time instead of the front. For transferring this patient, we're going to be using a cane for stability purposes as well. So when we start to move, I want you to use the cane to help assist me lifting you up off the bed. We're going to take short steps as we go around and put you on the chair. Okay? And with this one, you're going to want to step with the cane, and then your leg, and the cane, then your leg. Okay? All right. On the count of three, we're going to lift up. Ready? 1, 2, 3. There. Good. I'll move this leg for you. Okay. One more. Let's sit down. And I forgot to mention before we started that as you're moving this patient, since they have limited control of their leg, you might want to use your own limb or your own leg to move their affected leg throughout the transfer.